Now, I again try to emphasize upon you certain other basic things regarding this theory examination. And also oral practical also. There also these basic things do count. Now, you will find that a majority of cases of your examination, you will be asked a very basic question, and that is in the examination, a very basic question is asked, not only in this branch of medicine as obstetrics and gynecology, but also in surgery and medicine also. And that is, it is what is called the definition. Okay, so definition is one of the very basic things that is asked in undergraduate examination. And remember, definition is a set of parameters that will actually define a particular thing. Now, if you forget these parameters, your definition will be incomplete and it will no longer be considered as definition. So you must know the basic parameters which constitutes the definition. Please stop talking while class is going on. This is very unfair. So the main problem with the definition is if you do not know the definition properly, you cannot produce a definition on the examination hall. You will definitely lose certain points, and then it no longer becomes a definition. For example, I am giving you an example. For example, you are asked, say, define normal labor. Define normal labor. If they say define normal labor, that means you'll have to say that there are certain parameters, and these parameters, if these parameters are fulfilled, we can call it a normal labor. So, what are the parameters of normal labor? Normal labor means the delivery or expulsion will be per vagina. So, expulsion per vagina, that is number one point. Second point is expulsion per vagina of a mature and live fetus. Remember these points. The fetus must be mature. So if the delivery occurs preterm, it is no longer a normal labor. If a dead baby is delivered, it is no longer a normal labor. So mature live fetus. Then comes presentation. A mature live fetus presented by vertex. That means if there is a breech presentation, even if it is delivered vaginally, it is not a normal labor. So presentation should be vertex. Followed by not only the delivery of the fetus is normal labor. So followed by that of the afterbirth. That means the afterbirth, that is the placenta, that should also be delivered properly. And the whole process should be three other points: spontaneous, uncomplicated, and not delayed. Okay. So this way you will have to produce the definitions, and unless you can answer this definition question, sometimes examiner will not progress any further at all. At least in our time it used to be like that. So puberty basically is a time when a young girl actually the transition period from sexual immaturity to sexual maturity. That means before the onset of puberty, the girl is sexually immature, and after the puberty, she becomes sexually mature. So puberty is defined as then the period of time during which, what are the things that develop during the puberty? Secondary sexual characteristics. Then comes adolescent growth spurt. Adolescent growth spurt means at this period of time there is a sudden increase in the height, that is adolescent growth spurt. Then menstruation begins, that is an indicator that the girl has reached maturity. And some psychological changes also. The outlook of the girl becomes different, and from young psychology, she develops an adult type of psychology, aware of her sexuality and all these things. Now, what is the end result then? End result of puberty? Establishment of a fully mature reproductive status. Establishment of fully mature sexual status. That means fully mature sexual status means she can even conceive at this period of time. Before puberty, it is very unlikely for the girl to conceive, because the hallmark of puberty, that is onset of menstruation as well as onset of periodic ovulation, is established. So, each month the girl, when converted to a adult female, that produces ovum or ovulation in each cycle. Now, regarding this part of the puberty, we divide the phase of puberty into two main phases. One is the Gonadarche and the other is the Adrenarche. What is Gonadarche? Now, immediately after birth, a girl child, what is the status of the gonad? Immediately after birth, in the neonatal, infant period and time before onset of puberty, the gonads remain quiescent. In two aspects, if you think it rationally, the gonads remain quiescent in two aspects. Aspect number one, if you think of the hormonal aspect of the gonad, we all know that the gonads produce certain hormones, both in males and in females. Now, before the onset of puberty, the gonads remain quiescent. Or in other words, they do not produce hormones, particularly the gonadal hormones or sex hormones. There is no estrogen, no progesterone. But once puberty starts, the activation of the gonad with the production of the sex hormones, that starts and becomes apparent. So, maturity of the gonad, in that way you can call it, that is Gonadarche. And what is Adrenarche? In case of a girl or woman, if you compare with a boy or male person, the hormones that are produced by the adrenal are same. But there is a difference in case of the adrenal, production of certain hormones which are specific, particularly in case of females, that is adrenal androgen. Adrenal androgen. Now, what is the adrenal androgen? The marker of adrenal androgen is, again this can be an MCQ question to you. The marker of adrenal androgen is, anybody? The marker of adrenal androgen is dehydroepiandrosterone, DHEA. Dehydroepiandrosterone, DHEA. And this adrenal androgen actually contributes to the development of the sexual hair, the development of sexual hair. That means here around the pubis and here in the armpit. So these are sexual hairs developed by the effect of adrenal androgen. That's why it is called Adrenarche. Now, what is the purpose of this adrenal androgen, or in fact, any androgen? In case of a female, what is the purpose of androgen? Androgen basically is a male hormone, isn't it? So, what is the purpose of adrenal androgen or androgen at all in case of a woman? The level is much lower than that of a male, but still there is some amount of androgen present in a female. Why is it so? What is the purpose? The purpose is basically this androgen is responsible for the development of the sexual urge and libido, etc. So that is the biological action of androgen in case of females. In case of males, androgen has so many other purposes for maturation of spermatogenesis and all these things that is required. So you understand why adrenal androgen is there. So that is adrenarche, and there is another term that is called thelarche. What is thelarche? Have you heard the term thelarche? Thelarche actually means the development of the breast. The development of the breast starting from puberty right up to the attainment of adult breast development. Adult breast development. That is called thelarche. And when the Gonadarche is complete, if I say that in a girl getting puberty started, the Gonadarche is complete when there is onset of ovulation. And ovulation means there is folliculogenesis. Now what happens? The newborn baby, female, or say infant, in the ovary, there will be no maturing follicles. All follicles in the primitive and quiescent stage, they are there. And not only that, these follicles do not produce hormones, that is estrogen and progesterone at all. And why this is so? Because in this period, before the onset of puberty, the gonads are suppressed by hypothalamus. So, there is no establishment of gonado-hypothalamic-ovarian axis. So that remains suppressed or quiescent, whatever you want to say. So only with the onset of puberty they start functioning in a cyclic manner. Now, little bit of physiology of puberty. Now, between early childhood and up to 8 to 9 years of age, you will find that if you analyze the hormone pattern in the body, amount of LH, FSH, etc. will be almost undetectable level. Why? This is being controlled. So the LH and FSH comes from where? LH and FSH comes from the pituitary. Now pituitary then is for some reason or other suppressed. Suppressed by whom? Suppressed by the hypothalamus. So hypothalamo-pituitary axis is temporarily quiescent before the onset of puberty. So very small level of LH level, very small level of FSH will be there. And as because there is negligible amount of FSH and LH, so the direction doesn't come to the ovary, because pituitary gives the first signal to the ovary in the format of LH and FSH. And once the pituitary signals to the ovary by LH and FSH, then there is establishment of the hypothalamo-pituitary-ovarian axis. And then there is cyclic rise and fall of both FSH, LH, and also under the effect of FSH and LH, there will again be cyclical development of estrogen and progesterone hormone in the body. If you compare the hypothalamus of a male with that of the hypothalamus of a female, there is one basic difference. And what is that? The hypothalamic centers, in case of females, it is cyclic. That means you see, initially the LH starts to rise, there is a peak and then it falls. Similarly, FSH starts to rise and there is a peak and there is a fall. So this is typical of female hypothalamus. Not so in case of males. Because these are, in case of males, there is no difference in LH and FSH from time to time. If you take the sample today and say after 2 weeks, after 3 weeks, there will be more or less no change. It's a plateau. So these female centers are called clonic centers. And the male centers, they are called tonic centers. There is a constant level of hormones, LH and FSH going on. But in females, it is cyclic. Initially, the small level in the early follicular phase, then a peak, then it's a fall, like that. So this is the basic difference between the hypothalamic centers of male and females. What happens? They do not straight away jump and get elevated at the time of puberty. Before puberty starts, roughly about 1 to 3 years before the onset of puberty, the girl child will have surge of LH and FSH mainly during the sleep period. Newborn কি হচ্ছে LH FSH almost পুরো suppressed হয়ে আছে. No business of LH and FSH in the newborn, infant, etc. Now, whenever the time comes for puberty onset, just 1 to 3 years before the actual advent or onset of puberty, there is some spark of LH and FSH occurring mainly during the sleep. And then the whole activation of the LH FSH hormones in the pituitary. Now, normally there is a negative feedback also from the hypothalamic level. Hypothalamus also suppresses the pituitary glands not to secrete these hormones. Recently, there is one particular chemical that is now very much discussed, that is Kisspeptin. Kisspeptin is a recently discovered neuromodulator that controls GnRH secretion. So Kisspeptin actually stimulates the GnRH, and when the GnRH, that is gonadal releasing hormones, or sometimes they are not called hormones, they are also called gonadal releasing factors, GnRF. And when these GnRH or GnRF is increased, level of LH and FSH will rise. Now, next part we have already said, Thelarche. Thelarche means development of the breast. Initially, what happens? There is a breast bud formation. At the point of the nipple and around, there is a mond type of elevation that is called breast bud. Now, this breast bud then is the first sign. So, Thelarche followed by appearance of the pubic hair, followed by appearance of the axillary hair, followed by peak growth velocity, that is growth spurt, also called growth spurt, and lastly menarche, that is the normal development. The normal serial development occurs like that, but in many women or girls it may be little bit different, which means axillary hair and pubic hair. Pubic hair is the first to appear, then axillary hair. But it may so happen both the pubic hair and the axillary hair coming together, or maybe sometimes axillary hair is coming first, then pubic. That can also happen. But usual pattern, so if you're asked what is the usual pattern, then Thelarche, pubic hair, axillary hair, then peak growth velocity. That is very important. Peak growth velocity, or also called growth spurt. And lastly, menarche. Now, this breast development again has got a pattern. It is very difficult to differentiate all these patterns. The only thing that you must know for your examination purpose, this whole process of development of the breast, starting from the development of breast bud to full-term adult breast development, that is divided into 5 stages. You must know at least this particular part. These 5 stages are called Tanner classification. That is Tanner 1, 2, 3, 4, 5. Okay. Remember, Tanner 1 is elevation of the breast bud. That is Tanner 1. And Tanner 5 means fullness and contour of the breast. That is Tanner 5. Now, regarding the growth spurt, what is the significance of the growth spurt? Growth spurt is importance is key. Any woman who starts an early growth spurt, but if the sex hormone starts secreting earlier, then what will happen? That will lead to fusion of the epiphyseal part along with the shaft of the whole bones. That means when the epiphysis of a long bone and the shaft of the bone, they fuses together, that is the limiting factor regarding the growth of the long bones. তাহলে কারো যদি আগেই যদি গ্রোথ স্পার্টটা হয়ে যায় আর হরমোন যদি সেক্স হরমোন সিক্রিশন শুরু হয়ে যায়, তাহলে এন্ড রেজাল্ট হোয়াট উইল বি দ্য এন্ড রেজাল্ট? এন্ড রেজাল্ট হচ্ছে শর্টেনিং অফ হাইট। যার জন্য এর পরে আমরা আসছি, আমরা এখন প্রিককশাস পিউবার্টি বলে একটা কথা আছে। That means premature, you can say. Precocious means premature. So when puberty occurs earlier than the normal age, this thing happens. Why? Because whenever there is early onset production of estrogen actually, what it does, it causes epiphyseal fusion with the shaft of the long bones. Once there is fusion of the epiphysis with the shaft of the long bone, the growth of the long bone is stopped. So they may have an early growth spurt, but at the end they will end up in a shortening of height. Further growth will be stopped. Now, why this growth spurt occurs? Obviously, the growth spurt is related to one basic hormone, that is growth hormone or GH. But also another hormone-like factor is important for this growth spurt, that is IGF-1. Insulin-like growth factor 1, that is also responsible. The axillary hair development occurs after the pubic hair development. So pubic hair comes first, then axillary. But it may occur simultaneously also. That is rather a variation. So if you are asked what is the cause of Adrenarche, they will give you certain hormones. Say they write down androstenedione, testosterone, DHEA. Answer will be I have told you before, the hallmark of adrenal androgen is DHEA, dehydroepiandrosterone and its sulfate. DHEA, dehydroepiandrosterone. So, the cause of adrenarche is DHEA, not testosterone nor androstenedione. Now, there is another term that you should remember, isolated appearance of sexual hair before the age of 8 years. That is called premature puberty. So, isolated appearance of sexual hair in the pubic region before 8 years. That is called premature puberty or precocious puberty. And what is then menarche? Definition: menarche. It is the onset of the first menstrual period. That is called menarche. And I have already discussed. So, average age group of first menarche is roughly around 11.5 years. It has been found in extremes of climates, particularly where there is very low temperature, there the menarche is delayed. So, extremes of climates, particularly say in Russia and all this, those countries having that sort of temperature, their menarche is delayed. Now, this age of menarche varies with other factors also. How it is related to nutrition, how the menarche or sexual maturation is related to nutrition. Say, undernutrition, will they have early puberty and early menarche or the reverse? Huh? Why? You are correct, but then why? You will have to explain. Why? Can be the cause of anemia. It is not a direct answer. Actually, in case of say malnutrition or poor nutrition, what happens? The body proteins are reduced, and majority of the hormones, they are actually combination of several amino acids. So undernutrition group, their hormonal status automatically becomes much less. That is one reason that undernutrition, etc., the menarche, puberty, onset, etc., will be delayed. But other than these, there are some other factors also. That is genetic factor. That's why when you are dealing with a patient with a delayed menarche and all these things, we always ask the family history. Ask categorically if the other siblings, say they have 2, 3 daughters, and 2, 3 sisters. So we'll always ask the elder sisters, did they have the same delay in onset of menarche or puberty, whatever it is? Or in some cases even we ask about the mother, whether the mother also had delayed menarche and all these things, because that matches sometimes. So genetic factor is the one factor, nutritional factor is another, and climate I have already told there is another. Another thing that is quite often asked, the development of this puberty development and maturation, it depends on a particular critical body mass. If that critical body mass is not attained, reduced, in case of malnutrition, etc., in that case, onset of menarche, etc., will be delayed. And there is another thing that is also asked, in case of athletes, those who actually are used to rigorous physical activity for the purpose of development of athletic abilities, there also there is delayed onset of the period. And not only the delayed onset of period, sometimes these athletes, they face a spell of amenorrhea, that is also called athlete's amenorrhea. Now, next point is delayed puberty. What is delayed puberty? Delayed puberty means onset of the puberty developments are, delayed. So, more or less by 13 years, majority get the puberty manifestations more or less established. Development of breast, axillary and the pubic hair and all these things, that is more or less established by 13 years. But if it is delayed, which means by the age of 13 years, if all these criteria, they are not developed at all, then we call it delayed puberty. And this delayed puberty means not only the onset of menstruation, but development of axillary and pubic hair, development of the breast, that is Thelarche. So nothing has come out by the age of 13 years, then we call it a delayed puberty. Now what are the causes? Hypogonadotropic hypogonadism. Hypogonadotropic hypogonadism means there is hypogonadism, but it is secondary to hypogonadotropic level of FSH and LH. So whenever FSH level is less than 5 milli international unit per ml, then it will produce hypogonadotropic hypogonadism. And there is another term that is called hypergonadotrophic hypogonadism. Here the FSH level is raised 40 milli international unit per ml. But we are more concerned with a hypogonadotrophic hypogonadism. What are the causes? Number one is constitutional. Sometimes it is called idiopathic. Constitutional or idiopathic, that is number one. CNS abnormality. There may be meningitis, infection on the brain matter, and there may be even tumors, brain tumors, etc. Isolated gonadotrophin deficiency. One such condition which is called Kallman syndrome. In Kallman syndrome, there is hypogonadism along with anosmia. They cannot smell. That is called Kallman syndrome. Regarding the miscellaneous group, we have severe chronic illness or malnutrition. There is another peculiar type of delayed puberty. In a case what is actually it is singled out a separate variety that is called anorexia nervosa. Anorexia nervosa. These girls are very thin, and nowadays it is also a very sort of fashionable to develop such a thing, because over-conscious and over-health conscious means they don't want to put up any weight, and they reduce their diet to such an extent that ultimately they develop this condition, anorexia nervosa. Now certain psychotropic drugs can also produce, and then Cushing syndrome and primary hypothyroidism. So all these can produce hypogonadism. Commonest cause is, again an MCQ, commonest cause is constitutional. Commonest cause is constitutional. Family history, in fact, is found in about 70 plus percentages, showing the mother also had a delayed puberty. Now, hypergonadotrophic hypogonadism. Here again there is delayed puberty and elevated FSH. And in such cases, karyotype is to be done. Sometimes chromosomal abnormalities are present. In this group, the chromosomal abnormality group, particularly the Turner mosaic. Turner mosaic means there are two cell lines in the body. One cell line is 45XO and another cell line is 46XX. Now certain infections can produce this condition, like mumps sulfuritis, pelvic tuberculosis, mumps, euphoritis, pelvic tuberculosis, metabolic diseases, galactosemia, that is metabolic disease, and iatrogenic, that is surgical removal of ovaries or chemotherapy. There is another condition which is called, though rare, is called gonadotrophin resistant syndrome. In that case, receptors where the gonadotrophin are to be activated by hormone receptor complex is absent. So due to the absence of gonadotrophin receptors in the ovary, they do not respond to the gonadotrophins. Gonadotrophin level goes high, but they cannot stimulate the ovaries because the gonadotrophin receptors are not there. That is called gonadotrophin resistant ovary syndrome. Now we are coming to the next part, that is precocious puberty. So what is precocious puberty? Instead of being delayed, yes? Bolo? Early onset, yes. Very good. But actually, there are certain age landmark to be mentioned, right now? Early means how much early? It should be less than 8 years. If it is less than 8 years, then it is labeled as precocious puberty. Now, precocious puberty can be classified into 3 categories. Central precocious puberty. In central, otherwise everything is alright, only the onset of all the milestones are early. So, early maturation of the Thelarche, pituitary gonadal axis, GnRH prematurely stimulates the production of FSH and LH. This is the idiopathic group, and this idiopathic group is the commonest group, 80%. So if you come across a patient of this premature or precocious puberty, you will find that almost 80% of the cases they are constitutional. That means other than the timeline onset of this phenomenon, Thelarche, Adrenarche, Menarche, etc., there is no other abnormality involved. Just they start their maturation process earlier than normal. No other pathology. So that's why they are called the constitutional, or even another name is chosen sometimes. It is called idiopathic. Idiopathic. Second is called the peripheral precocity. That is also called gonadotrophin independent, caused by excessive secretion of estrogen or androgen. And this excess estrogen and androgen, they are not under hypothalamic control. Normally what happens? Your development of estrogenic hormones and androgenic hormones are under the control of the hypothalamus. But here it is independent. That means hypothalamic hormones are not stimulating the ovary, but for some other reason, ovaries are producing overwhelming level of estrogen, progesterone, etc. Another is the benign non-progressive process. Development is not due to underlying pathology. Now, isolated premature Thelarche and isolated premature Adrenarche are usually variants of normal, and that doesn't require any intervention at all, in fact. তাহলে আমরা ইভ্যালুয়েশন করতে গেলে প্রিকশাস পিউবার্টিতে কি করব? আমাদের প্রথমেই দেখতে হবে যে LH-FSH লেভেলটা কি আছে। যদি if the LH-FSH level is more than 0.3 international unit per ml, and it is the most valuable laboratory finding of central precocious puberty. So we'll have to do an LH level. LH level of more than 0.3 international unit per liter. The basal level of LH should also be compared, and also the LH level after injecting or administering GnRH, gonadotropin releasing hormone injection. That means whether the GnRH can stimulate the ovary or not. In that case, another important thing we'll have to do is whether to diagnose or to have the suspicion of some pathology at the level of the brain. So for that, you'll have to go for an MRI for a microadenoma or like that, a small tumor, etc. So that analysis has to be done. Now, what is the treatment of precocious puberty? কি ট্রিটমেন্ট করবে? Precocious puberty প্রবলেমটা কি? There are two problems. Problem number one is because the hormone production, sex hormone production starts earlier. That means there will be closure of the epiphysis, premature closure of the epiphysis. And premature closure of the epiphysis hole ki hobe? The long bones will be reduced in their adult size. That means it will affect the height of the woman concerned. এটা হচ্ছে একটা। আর সেকেন্ড হচ্ছে কি, particularly important second, that is because there is precocious puberty, so the girl is getting sexual maturity much earlier than normal, and if she is not protected, she may have by some assault by some males or whatever it is, and unwanted pregnancy presenting and complicating the matter. So these two things must be highlighted and must be taken into account while managing such a precocious puberty. Now, this when you diagnose this, to prevent the shortness of the height of the girl, we can give GnRH agonist, because GnRH agonist, when they are given in a continual manner, long-term GnRH agonist actually suppresses the GnRH hormones. So GnRH agonist is very much helpful, at least to not to curtail the height of the woman concerned. And then we'll have to focus upon the assessment of the whole CNS, particularly the brain and the hypothalamus, etc. region, by MRI, etc. Because sometimes it may be the result of some CNS tumor, where the question of surgery comes to control that. So you will have to have MRI scan of the brain to find any abnormality in that level. আর একটা কথা আছে, যদি CNS কোনো টিউমার পাই, then surgical resection, that will be the answer. There is another term called peripheral precocious puberty. What is it? First of all, it doesn't respond to GnRH agonist. Why? Aromatase inhibitors like letrozole, anastrozole, tamoxifen, etc. And sometimes they are associated with hypothyroidism. So in all such cases of hormonal imbalances, you must consider particularly the status of the thyroid, whether it is euthyroid or hypothyroid. That must be clear-cut determined first before starting therapy. Because it has been found in endocrine problems that there are certain cases where there is multiple hormone producing difficulties or disturbances. Previously, in our times, they used to call it polyglandular syndrome, like that. So several hormone producing organs affected, and thyroid is a very common in this group. So you must rule out Hypothyroidism, all cases before starting management.